I'm a board certified neurologist. Having two people tell me that I need to get surgery. My knees failed surgery at this point, and I'm seeing these patients too as well who have all these injuries and things where they're telling me from other docs that their things are neurological. And so at that point, I had to find a way to see how I could get past this. I started learning about platelet-rich plasma, or PRP, um, which you come to see amongst many athletes that get that now, and now it's a bit more commonplace. One day, I was in my clinic after work, and I just started treating my shoulder. It actually took several treatments to undo the steroids that actually were injected into my shoulder. For a lot of people, where they were told, "Hey, your surgery is the only option, or you take these pain medications," we were able to help many of them overcome that, where they didn't need to do that. Depending on how bad it is, there are also autologous stem cell therapies where there's bone marrow that we take, it's basically a bone marrow fluid that we take out, and that also has a lot of different growth factors too as well. And some of that also can stimulate more of the native tissue and remodeling of the tissue to actually heal and get better over time. So it's more of a robust treatment than actually the.
I'm Garret Wong, and this is the Investing to Win podcast. How do you define success, and what does winning look like for you? Fawad, welcome to the podcast.
Thanks so much for having me. I really appreciate it today.
Absolutely. So, audience, Dr. Mian is here today to talk about actually something that's very I'm passionate about, health, welfare, that type of thing. As a struggling entrepreneur, as I'm sure a lot of my audience are, I think it's important to keep balance.
Mm-hmm.
But Fawad, why don't you tell the audience, sort of give a little bit of a brief background, and then I'll ask some questions to really dig into the subject.
Yeah, sure. I mean, for myself, I'm a board certified neurologist. Started out in practice in 2009, and kind of how I got into regenerative medicine kind of occurred because of the own injuries I was having. I was seeing a lot of things in the office where I was told by other specialties that these things were neurological when they kind of weren't. It's because of the issues that were just being neglected, and at the time, I didn't know what to do with them. A lot of times, it was forced being taking medications that sometimes can make people feel unwell, or sometimes sick or sleepy, or if, as you mentioned, being a busy entrepreneur, being able to function properly, doing the job you're doing or creating the business that you're doing, and so it affects a lot of people. And for me, I started injuring myself in my 30s. Just when you feel like you're indestructible and you feel like you can't get hurt, then it starts happening. That's exactly
Uh,
when it
you
starts
know,
happening.
yeah, my wife says 50-year-old. I play beer league hockey. My wife says 50-year-old should not be playing hockey, but that's another case here. So
Well, hey, if you can keep going, keep going.
yeah,
Uh,
absolutely.
but yeah, I was in my 30s, and so I was actually lifting some weights. I was doing some shoulder shrugs, and the weight just slipped, and I ended up hurting the small joint in the front of my shoulders called the AC joint. Common injury also in other sports like football and things like that. And it was hard for me to put my arm above my head. It was hard for me to put my arm behind my back. It was hard to sleep on it. I couldn't get stuff out of the cupboard. Couldn't lift weights, and I loved lifting weights. I was miserable, and I felt pretty bad. At the same time, I'm still seeing patients who have a lot of these chronic injuries. They're getting steroid shots. Some of them are getting surgeries, and still kind of scratching my head on how do I better these patients ultimately. And while all of this is happening, then the next thing you know is one day I just woke up and um, my foot started hurting. Prior to this, I had been in New York City where I did training and I walked a ton, just everywhere. You just walk a ton. The best shape of my life, obviously, but you walk a lot. And I developed something called plantar fasciitis. And
Hmm.
what that really is just a fancy way of saying just some of the tissues underneath your foot are inflamed and swollen. And so at this point, I'm limping, my shoulder hurts. I went to the foot doctor because that's kind of what you expect to do, right? You go to the foot doctor because your foot hurts. And so I went to the foot doctor. The foot doctor took some x-rays, um, gave me some orthotics, which were obviously a bit on the pricier side. But I was like, okay, that's fine. They actually made my feet feel worse. And then he gave me some steroid injections into my foot. And again, because I thought, hey, steroids fix and solve a lot of problems in general. And that's kind of what happens in traditional medical model, at least in the U.S. I don't not so sure about Canada per se, but so I got these and I felt a bit better. And so what I did, I was like, okay, fantastic. I'm gonna go run on the treadmill and go running. That was probably one of the worst things that I could do because then at that point I injured my Achilles because that's just technically a continuation of tissue that goes down, just kind
Yeah.
of comes back up the other way. And at this point, I was really limping around. I had to get these Frankenstein shoes. Even then, I bought all these shoes, and my accountant's like, "Why are you buying so many shoes? Like, this doesn't even make any sense. Like, I need work shoes to work in. I feel miserable." And while all this is happening, it's changing how I'm moving. And so, what's changing how you're moving? Then my left knee starting getting infected. Um,
Oh boy.
so just to get people to understand is that I tore my ACL playing of all things ultimate frisbee in my 20s, and I had it surgically repaired. And I never was quite the same afterwards. I could never work, do things as athletically as I wanted to. But now that same knee is hurting 12 years later after having had that surgery. And so between my shoulder, between my foot and my knee, I was miserable. My shoulder, I was still miserable, and I went to the orthopedic surgeon because that's what you do, right? You go to the orthopedic surgeon. And so one of the first things he says to me is, well, maybe there's something called a slap tear, which is a fancy way of saying some of the cartilage is torn in your shoulder.
Hmm.
So maybe we can get a surgery out of it. I'm like, that's not exactly what I want to hear when I go see the doctor, right? But that's what he's telling me. Thankfully nothing was torn, but I had like a lot of arthritis in my joint that I mentioned where I had the injury, and I had gotten a couple of steroid injections. And even though I felt a little better, I still felt miserable. I couldn't lift weights. I'm here in my mid to late 30s at this point. I'm like, this can't be happening. I would have thought maybe in my 40s, maybe my 50s, this stuff would be happening, but this is kind of early on. And the orthopedic doctor is telling me, look, this is not getting any better. The next step would be you just don't worry about it. We're just going to slice off part of your bone so that it's not pinching on top of the tendons that are underneath there.
Sounds wonderful.
Yeah, I'm like, well, yeah, it sounds like a great idea. I've already had surgical repair on my knee that, as I found out later on, actually the ACL repair didn't repair very well, so it was completely torn again. It may have been, and it may have never been put in right in the first place, ultimately, and I had a lot of knee pain there. The foot doctor, when I went to him and I wasn't getting any better after all of that, he's like, you know what? Maybe you just need to shave down some of the bone on the back of your heel. It's not just shaving down the bone, which sounds pretty gruesome as it is, but it's also taking off the tendon, cleaning up the tendon, reattaching it back onto the bone. So it's a long, involved process in terms of trying to get that better. So at this point, I'm having two people tell me that I need to get surgery. My knee is failed surgery at this point, and I'm seeing these patients too as well who have all these injuries and things where they're telling me from other docs that their things are neurological. And so at that point, I had to find a way to see how I could get past this. And there weren't a whole lot of resources for me. Not the amount of resources now that are out there for people, not only for physicians but also just for patients. There's so much out there and so much that's ubiquitous for people. It's easy to find things and people. Back then, I mean, still, it was 2011, 12-ish. Yeah, it's modern, but they were hard. It was very hard to find anything. And so I stumbled on something called prolotherapy, and what this really was is this was just an injection that created a local inflammatory reaction to try to help heal some of the injury. And so I found a place in Denver that actually did it. And there was actually a course that I did for training too as well. I got treated. I started feeling a bit better, but ultimately it wasn't enough. I started learning about platelet-rich plasma, or PRP, um, which you commonly see amongst many athletes that get that now. And now it's a bit more commonplace. I actually had to get a couple of PRP treatments for my plantar fasciitis, and that went away. For my Achilles, it was so bad, I actually had to do multiple rounds of prolotherapy and PRP to try to help stabilize that. So now I'm actually able to run. I don't need the Frankenstein shoes. I'm not stumbling anywhere. For my shoulder, I did PRP and prolotherapy on that, and I did that myself. I actually did that for my Achilles too. One day, I was in my clinic after work, and I just started treating my shoulder, and it actually took several treatments to undo the steroids that actually were injected into my shoulder. So what a lot of
Mm.
people don't know is that when you inject steroids into a joint, it actually starts eating away at the joint. So it destroys cartilage, it destroys tendon, destroys bone, destroys ligament over time. So you don't want a lot of steroids to be thrown into your knees, your hips, your back, and all that over time because it's ultimately going to make you go backwards. Um, and so that's something that I've been with these treatments. I've been implementing them with my own patients, and we've seen a lot of big results for people over time where they've been able to avoid going to get surgery. Eventually, I started implementing autologous stem cell therapies too as well. We'll probably be adding in something called microfat soon, but we're doing more bone marrow stem cells. And this also has been really helpful for a lot of the more of the major injuries. But we've been implementing this with a lot of patients, and often we find that they have these chronic musculoskeletal issues, whether it's a bum shoulder or a bad knee or a bad back. And for a lot of people, where they were told, "Hey, your surgery is the only option, or you take these pain medications," we were able to help many of them overcome that, where they didn't need to do that. I'll give you one example of like one patient who was a construction worker, and he was very physically active. So he kind of had to use his arms a lot, and his shoulders were, for lack of a better word, really torn up, a lot of damage to the tendon and the cartilage. And even I was surprised after doing one PRP treatment on his shoulder. He was like, "Yeah, I feel like 80, 90% better." And he was actually able to go back to work. And eventually, years later, we treated his other shoulder because that was getting beat up over time, but makes a huge difference. And for me, it was so profound. It's something where I've treated my own family members to my own mother, who was skeptical of everything in this world. Even my own wife, my father-in-law, my father, my mother-in-law, and obviously I've done myself many different times. And then obviously we've been treating patients and over the last 13 years or so with some pretty good results on most people. So I feel that this is something that really makes a huge difference and really prevents people from necessarily having to go to taking a bunch of pain medications or feeling that surgery is their only option ultimately.
Wow. Um, I've been listening to you, just fascinated
Mm,
here, taking notes. I don't know if I asked another question after. Just introduce yourself. Um, so many things I want to dig into, Fawad.
sure.
So it's very like I'm a walking Frankenstein.
Hmm.
I mean, my wife's a nurse, and again, other than 50-year-olds shouldn't play hockey,
Hmm.
I blew out my knee skiing, so I also have a torn ACL. Luckily, my repair when I was in my 20s, I'm 54 right now, has still held.
Hmm.
Um, Blew out my back, L5S1 laminectomy.
Hmm.
So I've had a lot of surgeries, and then I blew out my Achilles
Hmm.
doing a road race, and then I limped around for 10 years. And 3 years ago, I just had it surgically repaired with the awful bone scraping, everything else you've described.
Hmm.
But I also have two really bad rotator cuffs in both shoulders.
Hmm.
So I've heard of PRP.
Hmm.
I've considered using it for other things, but I've never quite heard of it being used for joints.
Hmm.
Why don't you back up a little bit? You know, you said what the definition was, but why don't you sort of put it down in layman's terms
Hmm.
what PRP is, the enrichment process, the
Hmm.
spinning down of everything for the audience?
Yeah. So just an easy way to understand, we essentially what it entails is a blood draw for a certain volume of blood, depending on what's going to be injected. It's put through a centrifuge to concentrate the platelets, which have a lot of growth factors that will stimulate a healing. And then what we do in our office, which is important, is we use ultrasound guidance for more precise injections. And that's kind of what we do. And we also, it's not just a matter of sometimes simply just treating one structure. For us, there's a concept called biotensegrity, and that's just a fancy way of saying how things are put together, how things are being held together. And so for us, it's looking at the structure as a whole to see what structures actually need to be treated. It's not just I stuck it in the joint, that's the end of it. It's,
Hmm.
well, hey, maybe that your medial collateral ligament is kind of beat up after you tore your ACL, or there is the meniscus that's actually frayed and destroyed there a little bit, or some of the ligaments that surround your knee too as well. And that's kind of what we do. And then depending on how bad it is, there are also autologous stem cell therapies where there's bone marrow that we take, basically a bone marrow fluid that we take out, and that also has a lot of different growth factors too as well. And some of that also can stimulate more of the native tissue and remodeling of the tissue to actually heal and get better over time. So it's more of a robust treatment than actually the platelet-rich plasma. But PRP is has been around now for a while and used pretty ubiquitously in many different areas.
Yeah, I mean, again, to dumb it down for myself, really what you're doing is you're taking the body's best healing
Hmm.
engine, concentrating it, and putting it where it needs to be.
Right.
Is that kind of a
Yeah,
layman's way
yeah.
of
So I
saying
mean, it's
that?
kind of basically taking your body's own natural healing ability and then stimulating it with basically your own stuff.
Yeah. So, I mean, the reason I'm very interested in this kind of stuff is I think everybody knows, nothing against surgery. I mean, if you need it, you need it.
Hmm.
But there's so many different things that happen other than just the construction part of it, right?
Hmm.
Again, with my knee, they did a patellar graft. So obviously you know this, but for the audience,
Hmm.
taking a portion of my kneecap
Hmm.
and then basically stapling it in where my torn ACL was,
Hmm.
which is very strong. And then they switched to a hamstring.
Hmm.
And now I don't even know what they're doing now.
Hmm.
But the problem, of course, for me is that I had this big, you know, half-inch graft by 2 or 3 inches out of the center of my kneecap,
Hmm.
and now it's swollen. It's not tracking properly, so
Hmm.
it's popping and clicking. I had
Hmm.
to have a year's worth of physio for that and
Hmm.
athletic therapy. So I guess my question to follow up
Hmm.
is, as a neurologist,
Hmm.
what made you start to incorporate that like movement and regenerative medicine
hmm
into your actual practice?
So with a lot of patients, I was kind of just generally mentioning is that they would come in with it. So for instance, I'll just give you an example. Maybe it might make a little more sense. So headaches are a very common thing we would see in the office. And I always tell people, your head is really just a victim in something else, whether or not it's, the stressors, your hormones, your environment, what you eat, what you consume, the chemicals. But a common thing are also chronic musculoskeletal issues. So
Hmm.
sometimes it could be an issue within the spine itself of your neck. Or another common reason that I see a lot that often goes unnoticed is a bad shoulder. Just give you an example. I had like two, like last week, where the orthopedic surgeon is sending the patient in saying, "Oh, patient's having headaches, maybe migraines or whatnot." And I found out, okay, there is a cervical spine issue, but there's a pinched nerve on the opposite side of where her symptom is. But as soon as I examined her shoulder and she was getting numbness and tingling in her arm, there wasn't a pinched nerve in the neck. It was, and in layman's terms, basically, it's kind of like the shoulder is falling off and it's taking everything else with it on the way down. And that's also tugging on your nerves. And so for me, I'm just kind of like, well, how is this even being missed? Because really the major issue is that she had some rotator cuff tears, a labral tear, which is the cartilage tear in there. And that's something that actually needs to be treated or injected. Or at this point for her, because it was so bad, then the obviously surgery is the other option to try to help undo some of this to a certain extent. So I've had patients like that in the past where we've actually had to do PRP into their shoulder, stabilize it, so they wouldn't get the numbness and tingling in the arm because your biomechanics will also start changing. Once this is off and this is off, how you move your hand and your arm changes. You'll start getting pinched nerves in your wrist and your elbows and all that. But as you're treating this, then that changes too as well, and then it feels better. But by the same token, as you stabilize this also starts getting better, where you people are having the headache and the neck pain because now muscles are not trying to hold on to dear life to try to help stabilize the joint at that point. At that point, it's going back to more of a natural state. So that's just one example of doing that too as well. I'll give you another example of somebody where did have a little bit of numbness and tingling in their leg and a lot of pain, and the doctors, wanted me to see it for a neurological issue. And I saw the way that she was walking. It turns out she had a really bum ankle. And so whenever she walked, her foot would really just collapse in. It would actually create such a torque on the leg where it actually affected the inside of the knee. So she was having knee pain, hip pain, and back pain. And so in her case, yeah, maybe she's irritating some of the nerves in there, but really we needed to treat the ankle, treat part of the knee to try to help stabilize all that to make the symptoms go away. Then
Yeah.
obviously, just one other example, more common examples would be somebody who comes in with a spine issue where they're having quote unquote sciatica, where the nerves are being irritated, and the way we look at it is, well, let's try to stabilize the ligaments, tendon, and joints so that they don't push up on the nerves and the nerves don't get irritated, because that's a lot of what happens ultimately with people over time. But spine is a very common thing that we would do that kind of goes more along the lines of what we do.
Okay. Um, Yeah, I mean, I have one sort of I used to be a scientist
Mm-hmm.
in molecular biology, so this is more of the science question of it.
Mm-hmm.
But is it a fallacy that, you can't, like, ligaments don't repair, tendons don't repair once they're torn, that's it? And then, I mean, if it's not a fallacy, obviously, things like PRP are helping these things.
Mm-hmm.
Like, what's going on inside those joints specifically that stem cell or PRP can actually help?
So number one, it's actually decreasing, and then again, this is more for the audience, like bad inflammation that's going on within the joint. Because once you start damaging the joint, the synovium becomes more full of like inflammatory cells and things that eventually just kind of perpetuate a breakdown of everything. So even if you did, withdrew, took out the fluid, that's one thing which is really important, and then injected PRP on that, it can kind of arrest a lot of that to help start stabilizing things. Um, I just gave you proof positive of that. Yeah, it can repair a tendon. So if you look at
Yes.
like treatments where you do this, you see that the morphology of the tendon changes. The tendon becomes tighter, the myofibrils become tighter, the tissue becomes tighter too as well. Versus something where you start seeing on the ultrasound, you can see micro areas of damage. You can see trying to say this way that's understandable for the audience, but different signal changes on the ultrasound where you can see the damage, and when you treat it, you can see how it looks different then at that point.
No, it's fascinating. I brought you on the podcast because, being an entrepreneur, I said
Mm-hmm.
this during the intro, we just push it, we grind it, we
Mm-hmm.
push it. Um, why don't you kind of walk through, maybe even, as a wake up call for some entrepreneurs that are
Mm-hmm.
listening to this, thinking, oh, you know what, I can keep doing this, I can keep pushing and grinding.
Mm-hmm.
Tell us what physiologically happens to the body of an entrepreneur.
Yeah, so I mean, there can be a lot of that with an entrepreneur, right? And this is from head to toe kind of thing. So just as a neurologist, I would say, even then, I'm obviously entrepreneurial too as well, and I push myself to limits that some people are like, man, how do you keep going and doing that kind of stuff? That's unreal. But and that's common amongst a lot of entrepreneurs, right? They can just keep going and going like the Energizer Bunny. But
Yeah.
mentally, it's one thing if somebody's constantly going and not really stopping, not taking the time to recharge or fill their cup, so to speak. Your cortisol levels are going through the roof. Your body is constantly in a state of you've heard of fight or flight before in high school, maybe with
Yep.
biology, or maybe you're a scientist. But and for others, the fight or flight state where you're constantly in a sympathetic mode and your body's on overdrive with all of this. And physiologically, you're not supposed to be like there's quiescence too as well, right? That's how a lot of bodily functions will work with our parasympathetic nervous system. And so if you're constantly doing that, everything is going to start breaking down. Everything is going to start hurting. You're going to start getting more brain fog ultimately if you don't take those breaks in. So I just give you an example or do other things that may be helpful, whether or not it's exercise or doing activities such as you're doing, or if it's like mindfulness meditation or gratitude and those kinds of things, which are also really important. Kind of mentioned this in some other place, in some other podcasts I've been on, but there's like there's a type of meditation done by Tony Robbins that's like 15 minutes where you're kind of visualizing different things. You're feeling gratitude towards small little things, and you're trying to build that up in your mind where your body thinks about things more positively, and you kind of essentially approach everything that you're doing with that attitude where it's more of a place of abundance rather than, man, I have to do this, or there's this negative thing that's going on and I don't know if I want to do this today, but I'm going to push through it anyway because I'm a warrior and I'm going to keep doing that kind of stuff. That happens a lot to a lot of people. It's not like an uncommon thing, especially if you have your own business or your own startup or whatever it is that you're doing or whatnot. That's tough. But eventually, it does impair your immune system too as well. And I kind of say this to like even patients, that I see is it kind of eats your body from the inside out. You just can't see it. And eventually it's that guy who I run like 10 miles a day, 5 times a week or whatnot, that drops dead of like a heart attack
Hmm.
because they've created so much inflammation in their body and they really haven't listened to their body or whatnot because they thought exercise was the only way of doing it. It's just also your mind that really makes a huge difference. Um,
Yeah, I was just going to jump in there. It's interesting you talk about meditation.
mhm,
When I was in grad school, I was doing an immunology course, and one of the thesis that I had to do, or that I chose to do, was the cellular effects of meditation on the immune system.
mhm,
And I mean, if you look at the literature, I mean, there's a definite link,
mhm,
and we're talking like right down to like the cell mediated immunity, T
mhm,
cells, like
mhm. Yeah.
all sorts of thing, like very hard links. So I'm a big believer in that. And so therefore, if you're listening to this and you're thinking, well, if I meditate, it's going to improve my immune system, my inflammatory response, et cetera, et cetera. If you're not meditating, okay, whatever, but then you're piling on all that stress,
Mhm,
your body is still reacting to it,
mhm.
right? And I think that's really what you're talking about, isn't it?
Yeah, it's just the constant stressors, and honestly, even then, I mean, even now, I'm at the point where I was one of those people just keep going, just keep going, but then you slam into that wall. You're like, I don't want to do anything. I don't have the energy to do anything, and you kind of get in that state where I just don't want to do anything, and then it takes
Yeah.
time to recover a little bit, and you veg out watching Netflix or whatever you're doing, and then you try to go back to it. But even for me now, it's kind of like, okay, you know what? I actually just need like one day where I literally don't do anything or do something fun or whatnot. Because then if I need to do anything on the weekend, say for instance, and I still do from time to time, I'm more efficient at doing that stuff now. It takes a much shorter period of time. I'm not like fumbling through that. So always got to take time for yourself. So even if that's exercise, meditation, prayer, whatever it is, for that individual, work on that because that's going to make you a much more effective entrepreneur.
Yeah, one thing my business coach is always saying is, the concept of time management is really a misnomer. He really preaches energy management. And I think that's what you just referred to,
Hmm.
because when you have the energy to do something, you probably will do it three times faster than
Hmm.
just being in a fog and trying to go through it. Um, I've heard you say when I was doing some research on you that, pain is a signal, but not the problem. Right. Let's talk about maybe a brief discussion on
Hmm.
early warning signs
Hmm.
that an entrepreneur should be on the lookout for before these small aches all of a sudden like really rear their ugly head, turn into life-threatening situations.
Yeah, I mean, I think I'd say when your body is feeling like any pain, you got to stop. Even if it's something that's kind of minor, well, why is that happening? Sometimes it just often easily gets kind of dismissed. But you want to see if there's is this kind of reproducing, doing a certain activity, or sometimes people have like they'll have like cardiac issues that they often go unnoticed. Say for instance, depending on their exercise tolerance and their levels, or maybe somebody for instance in that regard, maybe somebody's having some mild ED at that point, right? And they think not much of it. Maybe I'm just getting older and I need Viagra or whatnot. But the fact of the matter is that those guys are clogging up a lot faster than what's happening up at the heart. And so if you don't try to address that at that point, then eventually it's going to affect your heart. But even with minor little injuries, sometimes it's important to make sure that you get them addressed, especially as you're getting older earlier on, rather than waiting to the point where there's so much significant damage where it requires a lot to try to undo that ultimately.
Yeah, no, and I'm also thinking about energy management, or just feeling healthy,
Hmm.
and then confidence. I mean,
Hmm.
what's your opinion on the role of confidence with the body and how you can get maximum confidence? Because let's face it, as entrepreneurs, confidence is kind of our kryptonite, and it's our biggest strength,
Hmm.
right?
Yeah, I mean, the thing with this is that when it comes to confidence, I'd say confidence can come from many things. It can come from success. It actually can come from failure too, as well, where you fail, you fall flat on your face. But even for me, it's like if you fail enough or whatnot, you become that much more confident because now, hey, I've tested out X, Y, and Z, but I failed at this. Now I can make this tweak, and I can probably do a better job. I know the lay of the land, but it also comes in terms of like health. Say, for instance, if you feel that you're able to get your body to the state where your body is in no pain or minimal at best, where you're moving and you're functioning, you'll be able to do the physical activities like yourself, where you've had all those injuries, yet you're still able to play hockey ultimately or whatnot. just being able to know that you can do stuff with your body still at that age, and you can push yourself to a certain extent and still perform at a decent level of physical activity, that's a big confidence boost, right? You feel better about how you feel, and when you feel better about how you feel, it's going to carry itself out mentally, where actually you're making better decisions on, the business field, quote unquote, or so to speak, however you want to look at that. You're going to make better decisions at what you do.
Yeah, I would. I think about high performance athletes, and not say that there's not gobs of talent there, and
Mm-hmm.
God given gifts and things like that. But when you look at like somebody who's really good at what they do in sports and an actual like pro athlete, I think it's the confidence that really is
Mm-hmm.
off the chart on the pro, and then that obviously goes into like that really mental toughness, resilience. Like you think about somebody like Michael Jordan,
Mm-hmm.
right? Whether you love him or hate him on or off the court, his
Mm-hmm.
teammates, talk about the last dance, will say things like that. But I mean, that's a confident man. And that came from, and then the mental
Mm-hmm.
toughness that it took I think it's a lot from confidence.
Yeah, yeah, and I think they really go hand in hand, because if you also look at some of these high level athletes, it's they have certain mindsets and rituals they go through before they actually even perform or do anything, and they do it so consistently where they get themselves in that mindset that I'm going to be able to perform this, and I'm going to make this winning shot, or I'm going to be able to do this or that on the court, the field, the hockey rink, or wherever it is ultimately. And I think, that same thing can be taken to any entrepreneur too as well, even though it's not a sport that they're doing, but in the business going, hey, I know in this business meeting, I'm going to go over things I mind 100 times, knowing how I'm going to react to this or what I'm going to say. You get in that meeting, you're going to be ultra successful in that meeting because you know what you're going to do. You've kind of gone through the variables in your head. That makes a huge difference in your confidence.
Yeah. You know what me being so busy, and it's especially busy right now. I'm
Mm-hmm.
actually traveling to your area on Friday
Mm-hmm.
for another conference in New
Yeah.
York. But how do you convince a busy entrepreneur to take some for self care? I mean, I think that's the toughest thing that we
Mm-hmm.
struggle with, right?
Yeah, I think it really, I guess the answer to that, it really depends on where that person is at, because the fact of the matter is there are entrepreneurs who simply don't take care of themselves at all, and there are people who are just like they're bouncing off the wall doing 5 million different things, and so it kind of really depends on what that where that person is at. So, say for instance, if somebody's kind of on the lower end of that, where hey, you're not really getting much physical activity, um, could we maybe get our maybe get your gym shoes on, get your clothes on, go out for a walk. You feel like you don't have time, maybe you can do 5 minutes. Five
Hmm.
minutes may not seem like a whole lot, but at least now we're starting to build momentum if they're doing it consistently over a week or two. And then maybe another week, maybe get to 10 minutes and so forth and work your way up. Maybe eventually in a couple of months, you end up going to the gym, you start lifting weights and you start with a couple of pounds or whatnot. Um, I think for the busy entrepreneur, sometimes it's kind of sometimes a little bit of the opposite. They're doing a lot. Maybe it's also slowing down a little bit too. Um,
Well, you have to take the time to re-energize,
yeah,
right?
absolutely.
um, Yeah, I have a walking pad underneath my desk here.
Hmm.
It's a stand up desk, kind of motorized. Obviously, I'm not going to be walking on a podcast, but you mentioned walking, and let's spend a couple minutes talking about that because
Hmm.
yes, it's healthy,
Hmm.
assuming you don't get plantar fasciitis,
Hmm.
but the act of walking and thinking and mind feed is what my business coach talks about.
Hmm.
I don't think enough people, they think they're wasting time,
Hmm.
right? Like every time I'm walking, whether it's walking the dog or you go for a walk for half an hour,
Yeah.
I just find I come back and I'm full of ideas.
Hmm.
Or I've listened to a podcast, and again, that stimulated something.
Hmm.
Talk to the audience about, the benefits of walking. I know it's obvious, but from an entrepreneur's point of view.
Yeah. So, I mean, obviously, it goes without saying, walking is going to burn calories, improve insulin resistance. It's actually going to increase blood flow to your brain when you're walking. And I think the beautiful part about walking is that you're probably not playing with your phone. You're not looking at Instagram or Facebook or whatever social media that you're looking at. And What's beautiful about that, it's actually kind of like how we were growing up when there was less noise. A lot of these things in the periphery that we have, and now your mind actually can actually use its own creativity. Maybe those problems you weren't able to solve the whole week, all of a sudden you're just kind of walking, you're looking at the leaves or the tree, or you hear a dog bark, or you have a conversation with somebody along the way. It triggers something in you where you're actually like, oh, okay, now I think I can solve this problem there at this point. Uh,
Hmm.
so, I mean, it definitely makes a huge difference on the physiologic basis, but I think also just from an entrepreneurial standpoint, it's also going to help you clear your mind and at the same time probably help you solve problems that maybe you've had difficulty trying to figure out on your own.
Yeah, that actually takes me to a question I was going to ask
Mhm,
you. Your personal, I guess, advice for
mhm,
anybody, but we're talking about entrepreneurs. When somebody hits a setback, I
mhm,
mean, yes, you can embrace failure,
mhm.
but what's your, I guess, personal process for turning that moment into a stepping stone instead of like a brick wall?
Well, for me, it's kind of I've had many of those moments, and so I feel like I'm a pro at yeah, I mean, yeah, you can certainly like embrace failure, right? It's at the time, it's like, okay, this sucks. I didn't get to do what I want to do. I didn't accomplish what I want to do. Somebody else beat me to it, or whatever it is, or whatnot. But I'm like, okay, well, what could I kind of do a little post mortem to a certain extent. Well, what could I've done better? A lot of people do that, right? But then I try to take the positive aspects out of that. Okay, well, I did this well, but if I may tweak X, Y, and Z to this, maybe I could have gotten better at doing something like that. Um, and then I try to think of like different problem solving ways of like trying to overcome just repeating that scenario, but then thinking of problem solving ways of where I could have overcome that particular issue or I could have done better on that issue. And I kind of play that around in my mind over and over again, more on the positive side with all of that. And that kind of actually pushes me more. Also, the embracing failure, or or calling it teaching moments, is the other nice way of saying it, right?
Right.
They're teaching moments. You take those teaching moments and you really think to yourself, well, hey, I can certainly get past this. And for me, it's kind of like a little bit of the proverbial lighting a little bit of a fire underneath yourself to get going and get moving, kind of like that. And so sometimes I'll use it as a chip on my shoulder, like, look, I'm going to get past this time. I'm going to try this, and next time, I'm definitely going to have a lot more success than I did when I tried it the first time around.
Hmm. Hmm. As we're wrapping up here, it's I know that you know in the green room we were talking about that you've been on a few podcasts
Mhm.
lately. I'm just going to ask straight out, like, why are you trying to are you doing the podcast because you're trying to bring awareness to this movement, or is there a particular uh, thing in your particular clinic that you're able to do that others aren't, and they can maybe look you up? Because I mean, if I could, I mean, I'd see you this
Yeah.
weekend, but I mean, I don't even know if there's any practitioners here that would give me PRP for
Mhm.
my bad shoulders.
Yeah, I mean, so it's a dual thing. So number one, the biggest message that I have really is that I want to build more awareness of all of this because I feel like after doing practicing for the last 15 years now at this point, it's just amazing how much people don't know that this stuff actually exists out there. And obviously, things are different. With the health system in Canada is different than the health system in the United States, as you're probably pretty well
Hmm.
aware of. And
Yes.
as I'm getting used to, as my wife is Canadian and learning more about the system, it's a bit different, but still people just don't know enough about it. And so spreading that awareness for me is kind of important too as well. The other thing too as well is like, obviously I'm in the greater New York City area and New Jersey or whatnot. So for us to be able to be that beacon for people who do actually do want to get treated and get better, where they're looking for the alternatives to drug and surgeries, that's also why we're here. The fortunate part is that depending on where you are in the country, there are a lot of people that are around, but it's actually finding the right kind of people doing it. And what's really important as well is that to make sure that whoever's doing this is, they're doing it with some image guidance. They're comprehensively treating the area, but they're not just leaving it at that. What's also really important is also restoring functional movement too as well, because we can put whatever we want, like inside a joint and around the different tissues that are damaged. But if you don't go back to actually moving that thing better ultimately with either proper physical therapy or a functional movement person, you're likely to re-injure yourself ultimately. And the other thing we look at is, we talk about like cell health and increase boosting things with your immunity and boosting like internal stem cells within your body too as well. So we try to put a combination of all of those things together in order to get somebody better. So it's not just simply just a simple injection that's always being done in many different places too as well. The other thing that we're going to be doing very soon is actually we're going to be tracking our data soon too as well with every case that we're going to do, and then we're also going to start measuring concentrations of what we're doing. So a lot of people aren't doing these kinds of things, and so this is kind of a way to advance the science and make sure that we're getting getting better outcomes on people ultimately.
Is it even possible for you, again, I don't know about licensing and things like that,
Mhm.
to go across borders of states, even into different countries through using, I don't know, subcontractors as sub consultants, or has something you've never considered?
I mean, that's something that I've thought of. It's a little bit of so if so in the U.S. for instance, why this is I don't know, but every state has a different license. It's the same exact thing. It's a different credentialing process for every state, whether or not it's a money grab or a bureaucratic thing. I don't know ultimately or
Yeah.
whatnot, but they make it tougher to do things across state lines.
Yeah.
So we kind of have to be careful about what it is that we do and kind of navigate through, legally that we're making sure we're doing the right kind of thing. But that is a thought and idea that I had where we could get like subcontractors and different places to try to help. I don't know what the need is, Trace. For instance, that's kind of like the middle of the western part of Canada where you are, versus places like in the Toronto, Mississauga area. It seems like there seems to be more of a dearth of people that do that over there, more so than some other areas or whatnot. But it's amazing for different places where people are and where people aren't.
Yeah, and that's kind of my point. I mean, I don't know. I mean, I'm certainly going to check after we get off the call here,
Mm-hmm.
but something that I think I've been missing. I've been trying to stay healthy,
Mm-hmm.
eating better, try to keep the inflammation down, but just to actually, and then you use that term image guided, right?
Mm-hmm.
Versus we now have a relationship, and I know you, but
Mm-hmm.
short of me coming to New York for
Mm-hmm.
treatments, it's pretty tough, right? And
Yeah.
yet you're doing all this awareness. People are going to be listening to this saying,
Mm-hmm.
I want that guy, right?
Yeah.
So it's something to consider, anyways.
Yeah. No, absolutely.
So let's wrap up with a question I always ask every
Mm-hmm.
guest. It's going to be interesting to see what a board certified neurologist is going to say.
Okay.
So, um, this is the Investing to Win podcast. How do you define success, and what does winning look like for you?
So success for me is sometimes that's actually a harder question than I thought what I thought it would be. I thought it'd be a little more definable. Uh, but success for me can mean many different things. I would say like in the medical world, it's actually getting my patients back to being able to enjoy the things that they love to do. Where it's like I'm not thinking about the doctor. I'm just enjoying my life with my kids, my wife, vacation, wherever it is, and whatever they're doing. And then, even on the entrepreneurial side, it's building and growing. So for me, it's growing the practice. Maybe it is subcontractors down the line or licensing agreements or multiple locations ultimately. Um, but for me, it's being able to have a big enough footprint where I'm having a huge impact on many different people. And I'm actually able, so even if it's just advice versus even like medical treatment, where I'm having the impact where it's actually making them better in their life, no matter what it is. And so for me, that probably in my mind is like the largest part of success in my mind when I think about what I want to do with my life.
Yeah, no, well put.
Mm,
I don't know too many true entrepreneurs that aren't driven by bigger purpose.
mm,
I mean, I don't know actually anybody who's been driven by money. There's so many successful entrepreneurs that don't even have to work, and they work harder than anybody I know.
mm,
So, yeah, no, I love that take. Well, thanks again for coming on the podcast. It's been really, really great. I don't have a lot of the ability to talk, or opportunities rather, to talk
mm,
about health. So
mm.
this has really been insightful. Thank you.
Oh, thank you for having me on the show today.
All right, take care.
All right. Thank you.